Coughing mucus after eating can feel alarming, confusing, and hard to make sense of. A lot of people wonder if food is causing extra mucus, if reflux is to blame, or if something is going down the wrong way. Caregivers often notice the pattern too, especially when coughing starts right after meals, happens with certain foods, or keeps coming back. The tricky part is that mucus after eating does not always come from the same place. Sometimes it is throat mucus, sometimes it is chest phlegm, and sometimes eating simply stirs up mucus that was already there. Now, here's why this matters. The timing of the cough, the feeling in the throat or chest, and any other symptoms can give important clues. In many cases, the cause is something common, like reflux, post-nasal drip, or irritation. But in other cases, coughing after meals can point to swallowing problems, aspiration, or an underlying lung condition that needs attention. So in this video, we'll walk through what coughing mucus after eating can mean, how to tell the patterns apart, and when it's time to get checked.
So let's start with the basics. Mucus is the slippery fluid made by the lining of the nose, throat, and airways. It helps trap dust, germs, and irritants. Phlegm usually means mucus that comes from deeper in the chest or lungs. That distinction matters because mucus in the throat after eating is not always the same as coughing phlegm up from the lungs. One common cause is reflux, including LPR, which means stomach contents reach the throat and voice box. That can cause throat clearing, a lump feeling, hoarseness, and coughing after meals. Another cause is post-nasal drip, where mucus from the nose or sinuses drains into the throat and becomes more noticeable when you eat. Swallowing problems, also called dysphagia, can make food or liquid go toward the airway instead of the esophagus, the tube that carries food to the stomach. Now add the lung side. Asthma, COPD, chronic bronchitis, bronchiectasis, or infection can create deeper chest mucus that coughing may bring up after a meal. So the quick recap is this. Throat mucus often points higher up, while chest phlegm usually points deeper down.
Now, let's talk about what that can mean in real life. Here's the key difference. Coughing during swallowing is different from coughing later. If you cough right as food or liquid is going down, that raises more concern for aspiration or a swallowing problem. That matters because material may be getting too close to the airway. If the cough starts after the meal, especially with throat clearing, hoarseness, a sour taste, or worse symptoms when lying down, reflux moves higher on the list. In contrast, if you feel mucus sitting in the throat, especially with allergies, congestion, or frequent clearing, post-nasal drip may fit better. If the cough feels deep, wet, or rattly, and comes with wheezing, chest congestion, or shortness of breath, think more about lung-related mucus, such as asthma, COPD, chronic bronchitis, or infection. Color can help a little, but not enough on its own. Clear or white mucus is common with reflux, drainage, or irritation. Yellow or green mucus can happen with inflammation or infection. Blood in mucus is a red flag. So what this usually means is that timing, location, and other symptoms tell you more than color alone.
So what can you actually do about it? First, slow meals down. Smaller bites, careful chewing, and sitting upright during and after eating can help if coughing is linked to reflux, throat irritation, or mild swallowing trouble. Second, stay well hydrated, because thin mucus is usually easier to clear than thick, sticky mucus. Third, if you already have a diagnosed mucus-producing lung condition, basic airway clearance and nebulized sterile saline may sometimes help loosen mucus, but only when your clinician has recommended it. Now, here's where it gets important. Please get medical advice if coughing mucus after eating keeps happening, if it happens with most meals, or if you also notice choking, a wet or gurgly voice, trouble swallowing, repeated chest infections, fever, chest pain, shortness of breath, weight loss, or blood in the mucus. Seek urgent care right away for severe breathing trouble, ongoing choking, blue lips or face, severe chest pain, or signs of a serious allergic reaction. This is general information and not a substitute for medical advice from your own clinician. If this helped, consider sharing it with someone who's been wondering why meals trigger coughing.